Hi, I'm Dr. Grace. I'm an endocrinology fellow, and here with me is Dr. Hope.
Hi, I'm Dr. Hope. I'm endocrinology attending with over 20 years of experience and board certified in endocrinology.
Yeah. And today we are going to be talking about pre-diabetes. Pre-diabetes is a very common medical condition. Do you know that about 84 million adult Americans have pre-diabetes and 90% are not aware that they have this? And that means 1 out of 3 adult Americans have pre-diabetes. And that is why today we are going to talk about pre-diabetes in detail so that you and I can be well informed. So what is pre-diabetes, Dr. Hope? Can you help us out?
Sure. So, prediabetes is a condition in which your blood sugar is not exactly normal, but it's not in the diabetic range. So, specifically, if a blood sugar is checked and it's between 100 to 125 while you're fasting or while you haven't eaten for at least 8 hours, then that is considered prediabetes. Another way to diagnose prediabetes is a blood sugar between 140 and 199 randomly taken throughout the day. If you've eaten within 1 or 2 hours, or just randomly throughout the day, non fasting. And finally, prediabetes can be diagnosed with a hemoglobin A1C, and that is a 3 month average of your blood sugar. It's a blood test that's done for diabetics to evaluate how well controlled your diabetes is, but it can also be used to diagnose prediabetes. And the number there is a level of 5.7 to 6.4.
Wow, that's very important. So if I do nothing about it, what could happen if I have pre-diabetes and I don't want to do anything, or my doctor said there is nothing to do about it? Are there complications of this?
Well, if you don't do anything about it, then you can definitely become diabetic. And when you become diabetic, there increase risks of disorders that you can have, which include heart disease, heart problems. You're at increased risk of a heart attack and stroke, but you're also at increased risk of eye disease, kidney disease, and nerve damage, even leading to amputations.
Wow, that's bad. So that means it's best to take care of it once you are diagnosed or you notice you have it. It's best to be treated. That's
Definitely.
important point to know. So what are the ways that one can develop this pre-diabetes?
So there are several risk factors for prediabetes. The most important risk factor is being overweight or obese. Obesity is technically defined as a body mass index over 30, and overweight is a body mass index over 25. And a body mass index is just a way of measuring your weight as it compares to your height. So that is the key driving factor in prediabetes and diabetes. So
I
that
see.
is one of the most important things that needs to be worked on. The other risk factors for prediabetes are family history of diabetes. So if someone in your family, specifically a close relative like a parent or sibling has had diabetes, then you're at increased risk of prediabetes and diabetes as well. If you've had diabetes during pregnancy, if a woman has had diabetes during pregnancy, she's at risk of becoming diabetic even after she delivers and remaining diabetic. Patients with or people with high blood pressure are at risk of becoming diabetic. Certain ethnic groups like African Americans, Asian Americans,
Mm-hmm.
Latinos,
Okay.
um, Native Americans are at increased risk of becoming diabetic as well. People who are physically inactive are at higher risk of becoming diabetic, and people with high cholesterol and something called polycystic ovarian syndrome, which is an abnormality of hormones in a woman that actually is due to more male hormones like testosterone compared to the female hormones.
Wow. So we have to watch out for all these risk factors and make sure that we prevent this by all means. So if we don't treat, we've been told that 70% can go into diabetes. And just as you've mentioned, that it's one of the complications of it, that they can go into type 2 diabetes. So how do we prevent ourselves from having pre-diabetes?
So, since one of the most significant risk factors of becoming pre-diabetic and diabetic is being overweight or obese, the best thing you can do, the most significant thing you can do, is to reduce your weight by 7%. And how do you do that? One is decreasing the amount of carbohydrates and sugars in the diet, and also exercising regularly. It's recommended that we exercise at least 30 minutes for at least 5 days a week. And so, regular exercise and controlling your diet, decreasing the amount of starches, fatty foods, the amount of high carbohydrate meals, and the portion sizes. So, portion control is key. Not only eating foods that are low in carbs and sugars, but eating smaller portions can help prevent the patients from becoming pre-diabetic. And if you are pre-diabetic, it can prevent you from developing diabetes.
Wow. This is a very important topic, and that means that everyone, both young and old, should check their blood sugar with their doctor and to monitor it. And most times when we have this, it's usually monitored, right? We monitor it on a yearly or 6-month basis, or often to see how your A1C doesn't progress to type 2 diabetes. So check out and stay healthy. We'll be here every Saturday. Check us on at Ask Endocrinology. Ask Endocrinologists on different platforms on social medias, and we'll be here to answer any questions. All right, till then, stay tuned. Thank you, and have a wonderful day.
Thank you for joining us.